Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. I've reviewed your chart and recent history, but I'd like to hear more from you about how you're feeling lately, especially with the changes to your medication and the symptoms you've experienced.
Hello, doctor. Thanks for seeing me. Honestly, it's been a bit rough. Since my last visit, I've been really trying to stick to the Synthroid dosage as prescribed. It's been helping somewhat, I guess, because my stomach issues aren't as bad as before. But these leg pains are really bothering me. It feels like a shooting pain through both my legs, though it does get a bit better if I walk around or when I switch from sleeping on the couch to my bed.
It's good to hear that the adjustment in Synthroid is helping with your stomach issues. About the leg pain, do you notice any swelling or color changes in your legs?
No swelling or anything. Just the pain. It's like fire in nerves sometimes, and it's not just at night. I feel it off and on during the day, too.
Okay, that's important to know. You mentioned improving your medication adherence. Can you tell me more about your routine now compared to before?
Sure. Before, I was pretty bad with timings, often skipping doses. Now I've set alarms on my phone, and it helps me take the Synthroid first thing in the morning. I'm really trying to avoid any more complications.
That's a great strategy. Sticking to your medication schedule is key, especially with thyroid issues. Now, you also mentioned concerns about alcohol consumption. Can you elaborate on that?
Yeah, I feel a bit restricted. I used to enjoy a couple of beers in the evening, but with all these health issues, I was advised to cut down to 1. I miss the social aspect of it, you know?
I understand that it can be a significant change in your lifestyle. It's good to discuss these feelings as they play a big part in your overall well-being. Let's keep monitoring how you feel with this adjustment. Now, regarding the cysts found on your kidneys, especially the one on the left kidney, any concerns or symptoms you've noticed?
No specific symptoms from that. It was quite a shock, though, when they told me after the ultrasound. I'm worried about it turning into something serious.
It's completely natural to feel anxious about such findings. We'll keep a close watch with a follow-up CT scan. Now let's go over your recent tests and my assessment based on all the updates. Your thyroid function seems stable now, with a TSH of 3.5 ngu milliliter and free T4 at 1.2 n-grams diller, which is good news. The goal is to keep these levels within the normal range with your current Synthroid dose. Your kidney function, with a serum creatinine of 1.4 milligrams per deciliter and eGFR at 55 milliliters per min per 1.73 millisquared, indicates a mild decrease in kidney function, which we'll continue to monitor closely. The liver enzymes are within normal limits, and the complete blood count is also stable. Regarding the imaging, the cyst on your right kidney is simple and typically not a concern. However, the 3-centimeter cyst on your left kidney has characteristics that we need to investigate further with the planned CT scan. The goal is to ensure there's no growth or malignancy. For your leg pain, although it improves with movement, it would be beneficial to perform some additional tests, perhaps a nerve conduction study, to rule out any neuropathic causes. We should consider this after we stabilize your other conditions. Here's our plan moving forward. Continue with the current dose of Synthroid and retest your thyroid levels before your endocrinology appointment on January 3rd. Follow-up imaging for your kidney in February is crucial. I also want to see you back in 3 months for a routine checkup to reassess your thyroid function and kidney cyst status. In the meantime, maintaining your medication routine and minimizing alcohol will be important for your overall health. We'll also consider addressing the leg pain based on how things progress. Do you have any questions, or is there anything else you'd like to discuss today?
That covers everything, Doctor. I appreciate you helping me keep track of all these issues. It's a lot, but I feel more in control knowing the plan. Thanks for your help.
You're welcome. It's good to see you taking active steps towards your health. Remember, my team and I are here to support you through this. See you in January, and take care until then.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've been having quite a rough time with my health recently. Between my blood pressure and the diabetes, it feels like I'm always juggling medications. Sometimes I even forget to take them because they often change the pills, like their shapes and colors. It's confusing.
I understand that must be frustrating. It's important to keep those medications consistent. How about your blood sugar levels? You mentioned feeling drowsy at times.
Yes, that's right. I often feel unusually tired, and I'm not sure if it's my diabetes medication or the condition itself causing it. My blood sugar is around 132 most days, which isn't too bad, I guess.
That's a good fasting level, but we'll keep an eye on it. Now, you also mentioned some nerve pain. Can you tell me more about that?
Well, the pain is mostly around my legs. It can get quite unbearable. I was on gabapentin, but I ran out and haven't gotten around to refilling it. It's another thing on my long list of medications to manage.
Managing multiple health issues can indeed be overwhelming. Let's make sure we get that prescription refilled for you. How have things been with your mobility and your arthritis?
It's been tough. The pain runs from my hip to ankle. I've never had surgery for it. Just some over-the-counter painkillers when it gets really bad. And then there's my issue with eating because of my dentures. It's been a mess. I've lost weight because I can't eat properly, but recently I've started gaining a little again.
Dental health is crucial for nutrition, especially at your age. We need to find a solution that allows you to eat properly without discomfort. What have you tried so far with the dentures?
I've had 3 different sets made. None of them fit properly. They're uncomfortable and make it hard to eat, which just isn't helping with my energy levels or my weight.
That sounds quite challenging. We'll need to look into a better solution for you. Maybe getting you to a dental school where they might offer more tailored and affordable options. Now, about your high blood pressure, can you describe how you've been monitoring it at home?
I have a blood pressure machine. My readings in the morning are usually around 172/85, and by afternoon they drop slightly to about 168/82.
Those readings are higher than we'd like. Consistent medication will be key in managing those numbers. Let's review all your current medications today to ensure you're on the right regimen and discuss strategies to help you remember to take them.
That would be helpful. I really don't want to mess anything up with so many things already going on.
Based on what we've discussed, here are your recent clinical values. Your creatinine is 1.9, which is a bit high, indicating your kidneys are working harder than we'd like. Your eGFR is 44, which shows moderate kidney impairment. Your cholesterol levels are also slightly elevated with a total of 205, and your LDL is 122. It's important we manage these effectively to prevent any further complications.
I see, that sounds serious.
It's manageable with the right care. Here's what I propose. First, we'll do a medication reconciliation today to ensure you're taking the right medications correctly. I'll have a nurse work with you to create a medication schedule that you can easily follow. We'll also refill your medications for the nerve pain. For your dental issues, I'll refer you to a local dental school where they can address the fit properly.
That sounds like a solid plan. Thank you for being thorough.
Of course, it's important to address each issue carefully. I'll also schedule regular follow-up appointments every month to monitor your blood pressure and manage any other arising issues. It's crucial we keep everything under control and make adjustments as needed.
I appreciate it. I'm glad we could go over everything today.
I'm here to help. We'll work together to keep you as healthy as possible. See you in a month, but if anything changes before then, please don't hesitate to call the office.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Congratulations on your new arrival. Now, it's important to take care of yourself too. Keep an eye on your body's signals over the next few weeks. Firstly, watch for any excessive bleeding or foul-smelling discharge. These could be signs of an infection or other complications. Also, you might feel some cramping, which is normal, but severe pain could indicate a problem, and you should contact us immediately. Ensure you're getting plenty of rest and staying hydrated. If you have any issues with breastfeeding, we have lactation consultants who can help. Lastly, it's normal to experience a range of emotions, but if you feel overwhelmed or unusually sad, please reach out. We can provide support or refer you to a specialist if needed.
Now look at question 26.
Good morning, everyone. Today, I'll be discussing the protocols for rehabilitation progress reviews in our facility. Our primary goal is to monitor patient recovery and adjust treatments as needed. Every patient has a personalized rehabilitation plan, which is reviewed weekly. During these reviews, our interdisciplinary team evaluates progress through physical assessments and patient feedback. We focus on mobility, strength, and independence in daily activities. It's crucial to involve the patient in these discussions to understand their perspective and adjust the goals accordingly. Documentation is key. Each review is thoroughly documented to track progress and guide future care decisions.
Now look at question 27.
Hello, Mr. Jones. Today we're going to do a few exercises to check on how your memory and thinking skills are doing. Can you start by telling me your full name and today's date?
Sure, I'm Samuel Jones. I think it's July 15.
Close, it's actually July 18th. No worries. Now, can you remember these three words? Apple, table, penny? I'll ask you to recall them in a few minutes.
Okay, apple, table, penny.
Great, now let's try some subtraction. Can you subtract 7 from 100 for me?
That would be 93, right?
Yes, that's right. Now, can you recall the three words I asked you to remember?
Apple, penny, and I can't seem to remember the last one.
That's okay, Mr. Jones. It was table. These exercises help us determine how best to support your cognitive health.
Now look at question 28.
Today, I want to highlight the resources and support systems we have in place for caregivers at our hospital. We offer workshops on managing the emotional and physical demands of caregiving. These include stress management techniques and practical caregiving skills. Our social services team provides one-on-one counseling and can help connect you with community resources like respite care and support groups. Remember, taking care of yourself is not a luxury, but a necessity. Our resources are here to help you stay healthy and effective as a caregiver.
Now look at question 29.
Managing MS is a long-term journey, and we're here to support you every step of the way. There are several resources we can offer.
That sounds reassuring. What kind of support services are available?
First, we have a dedicated MS clinic staffed with specialists trained specifically in MS care. They can assist with medication management, physical therapy, and symptom control. We also offer psychological counseling to help you cope with the emotional aspects of living with MS. It's important to address mental health alongside physical symptoms.
I'm glad to hear there's comprehensive support. It can be overwhelming at times.
Absolutely. And that's why we also encourage joining support groups. Sharing experiences with others who understand can be incredibly beneficial.
Now look at question 30.
Welcome to today's training session on handling patient complaints effectively. Firstly, it's crucial to listen actively to the patient's concerns without interruption. Acknowledge their feelings and assure them that their issue is being taken seriously. Next, gather all necessary information about the complaint. This includes asking clarifying questions and reviewing the patient's records and previous interactions. Once you have a clear understanding, discuss possible solutions. Involve the patient in this process to ensure they feel heard and their needs are addressed. Finally, follow up with the patient after the complaint has been resolved. This shows commitment to their satisfaction and continuous improvement in our services.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome everyone. Thank you for joining today's detailed session on syncope, an often misunderstood and misdiagnosed condition that represents a substantial challenge in clinical practice. My name is Dr. Sarah Thompson, and as a specialist in cardiovascular disorders, I'm deeply engaged with the complexities of diagnosing and managing syncope. Today, we will dive deep into the nuances of syncope, explore its various causes, and discuss comprehensive management strategies. I will also share a case study that highlights the critical aspects of our discussion. First, let's define syncope clearly. Syncope, commonly referred to as fainting, is a transient loss of consciousness, typically caused by a temporary decrease in blood flow to the brain. It's characterized by a rapid onset, short duration, and a complete spontaneous recovery. The causes of syncope are varied and can be categorized into three main types: reflex syncope, cardiac syncope, and orthostatic hypotension. Reflex or neurally mediated syncope is the most common type and includes subsets such as vasovagal syncope, situational syncope, and carotid sinus syncope. It generally occurs in response to a trigger that causes a sudden drop in heart rate and blood pressure, leading to cerebral hypoperfusion. Cardiac syncope, potentially the most serious category, arises from cardiac or cardiovascular conditions, including arrhythmias, structural heart defects, and cardiac ischemia. Due to its association with increased morbidity and mortality, distinguishing cardiac syncope from other types is a critical aspect of the diagnostic process. Orthostatic hypotension, the third type, is defined by a sudden drop in blood pressure when a person stands up. It can be caused by volume depletion, certain medications, or autonomic nervous system disorders. Each type of syncope requires distinct diagnostic strategies and management approaches. Let us consider a case that illustrates the diagnostic complexity and the need for a structured approach in managing syncope. Mr. John Carter, a 63-year-old male with a history of type 2 diabetes and hypertension, managed with medication, presented to the emergency department with recurrent, unexplained episodes of syncope. His episodes were sudden, without any warning signs, such as nausea or lightheadedness, which are typically associated with more benign forms of syncope. Given the absence of prodromal symptoms and the patient's cardiovascular risk factors, we prioritized a cardiac evaluation to rule out arrhythmic causes. Initial workup included an ECG, which showed no acute changes, and cardiac enzyme tests, which were within normal limits. However, the lack of diagnostic findings from initial tests is not uncommon in sync evaluations, necessitating further investigation. We proceeded with a tilt table test, a valuable diagnostic tool in our arsenal, particularly useful for evaluating patients with suspected reflex or orthostatic syncope. During the test, Mr. Carter experienced a pronounced drop in blood pressure and heart rate upon tilting, consistent with a vasovagal syncope diagnosis. However, given his risk profile and recurrent nature of syncope, we also initiated continuous ECG monitoring to exclude intermittent arrhythmic events not captured during the initial assessment. The comprehensive approach in Mr. Carter's case, guided by current European Society of Cardiology (ESC) guidelines and supported by evidence-based practices from Harvard Medical School's research on syncope, was crucial. After confirming the diagnosis of vasovagal syncope with superimposed episodes of orthostatic hypotension, we adjusted his antihypertensive therapy and recommended lifestyle modifications, including adequate fluid intake and physical counterpressure maneuvers to prevent future episodes. This case exemplifies the importance of a thorough and systematic evaluation in syncope management. It also highlights the necessity for healthcare providers to stay current with guidelines and advances in the field. For those looking to deepen their understanding of syncope, I recommend reviewing the latest ESC guidelines and participating in specialized educational courses. Remember that managing syncope effectively requires a balance of clinical acumen, detailed patient history, and judicious use of diagnostic resources. It's a common yet complex presentation that can herald serious underlying conditions, making its proper evaluation and management absolutely vital in clinical practice. Thank you for your attention today. I hope this discussion enhances your ability to manage syncope with confidence and precision. I am now open to any questions or further discussion on this topic.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today we're delving deep into the world of advanced glycation end products, AGEs, and their role in chronic disease pathogenesis. I'm joined by Dr. Sarah Brighton, an expert in metabolic disorders and a senior researcher at the Harvard School of Public Health. Dr. Brighton, thank you for being here.
Thank you for having me. It's crucial to discuss AGEs because they play a significant role in the progression of various chronic diseases, including diabetes, renal disease, and cardiovascular disorders.
Let's start at the beginning. Could you explain what AGEs are and how they are formed?
Certainly. Advanced glycation end products, or AGEs, are harmful compounds formed when protein or fat combine with sugar in the bloodstream. This process, known as glycation, can be a normal part of metabolism, but becomes problematic when it occurs excessively, particularly in uncontrolled diabetes. Over time, AGEs accumulate in body tissues, leading to oxidative stress and inflammation, which are pivotal in the pathogenesis of many chronic diseases.
How does this accumulation affect the body's systems?
AGEs have a profound impact on many systems. In the vascular system, for example, they contribute to the stiffness of blood vessels, enhancing the risk of hypertension and atherosclerosis. In the kidneys, they can cause structural changes that lead to nephropathy. In diabetes, AGEs exacerbate the condition by further impairing insulin action and damaging pancreatic beta cell function.
It seems like a pervasive issue. Can you share a specific case that illustrates the clinical implications of AGE accumulation?
Certainly. I recall a patient, a 58-year-old male with long-standing type 2 diabetes, who presented with deteriorating renal function and signs of early vascular disease. His diet was high in processed foods, which are known to be rich in dietary AGEs. Despite being on medication, his HbA1c levels remained above the target, and he exhibited signs of endothelial dysfunction and increased arterial stiffness, indicative of significant vascular damage from prolonged AGE exposure.
What interventions did you consider for this patient?
We took a multifaceted approach. Firstly, we intensified his glycemic control to limit the endogenous formation of AGEs. We also advised dietary modifications to reduce AGE intake, emphasizing whole, unprocessed foods over processed ones. Additionally, we encouraged regular exercise to improve insulin sensitivity and enhance renal blood flow, helping to mitigate further damage.
Did these interventions have a positive impact?
Yes, over the course of several months, the patient saw improvements in both renal and vascular functions. His HbA1c levels decreased, and follow-up assessments showed reduced markers of inflammation and arterial stiffness. This case underscores the importance of understanding and managing AGEs as part of a comprehensive approach to chronic disease management.
That's a compelling example. For our listeners, especially healthcare providers, what are the key takeaways about managing AGEs in chronic diseases?
The key is early recognition and holistic management. Healthcare providers should educate patients about the sources of AGEs and their role in disease progression. It's not just about controlling one aspect, such as blood sugar and diabetes, but also considering dietary choices, lifestyle factors like smoking and exercise, and regular monitoring of disease markers. An integrated care approach can significantly delay the progression of complications associated with high AGE levels.
Dr. Brighton, thank you for sharing your insights and this enlightening discussion on AGEs and chronic disease management. It's clear that a deeper understanding of these compounds can lead to better patient outcomes.
Thank you for the opportunity to discuss this critical topic. I hope our conversation today inspires healthcare professionals to incorporate AGE management into their practice more rigorously.
To our listeners, we hope this episode has enhanced your understanding of advanced glycation end products and their impact on health. Stay tuned. Goodbye until next time.